Hello everyone and welcome back to MediInsights, where we unlock the wonders of wellness. Today we cover atropine injection, its main uses, how it works, typical doses, possible side effects, and essential safety tips so you can understand when it is given and when to get medical help. Starting with use of atropine injection. Atropine is commonly given to treat symptomatic bradycardia and to reduce secretions before anesthesia or procedures. It is also a first-line antidote for organophosphate and carbamate insecticide or nerve agent poisoning, where it counteracts excessive muscarinic stimulation. Next, dosage of atropine injection. For adult symptomatic bradycardia, the usual ACLS recommendation is 1 mg intravenous or intraosseous every 3 to 5 minutes, up to a total of 3 mg, while preparing further resuscitation measures. For children, dosing is weight-based, commonly 0.02 mg per kilogram intravenous, with minimum and maximum limits used in pediatric advanced life support. Always confirm exact pediatric limits with local protocols. Next, mechanism of action of atropine injection. Atropine is a competitive, reversible antagonist of muscarinic acetylcholine receptors, so it blocks parasympathetic effects on the heart and glands. By blocking these receptors, atropine increases heart rate, decreases secretions, and reduces bronchial and salivary secretions. Next, side effects of atropine injection. Common anticholinergic effects include dry mouth, blurred vision, sensitivity to light from pupil dilation, flushing, decreased sweating, and a fast heart rate. At higher doses or in overdose, patients may develop agitation, confusion, hallucinations, high body temperature, urinary retention, or severe tachycardia. Next, important advices for using atropine injection. Atropine should be given under medical supervision with monitoring of heart rate, blood pressure, and mental status, especially in the elderly and in those with glaucoma or enlarged prostate. If signs of severe anticholinergic toxicity appear, specific treatments such as physostigmine and supportive care may be required, so seek urgent expert care. Thanks for watching. If this cleared up atropine injection for you, please subscribe to MediInsights and leave a question or experience in the comments. And remember always to ask your healthcare team before using or receiving this medicine. Stay safe.